Thank you very much. It's fantastic to see you all today. Is Graham Allen here? Oh, yes, at the back. So we are all here today on a journey that Graham boldly set out on, to take the promise of early intervention to transform children and young people's lives. And the theme of today is to put that evidence into action. It's nearly 4 years since EIF was established, and we've got a lot to share with you from our work, and I know you also have a lot to share of your own experiences on this same journey. When I was looking through the audience list, we're a diverse group in the hall. We've got health visitors, children's services managers, police officers, academics, policymakers, charities, volunteers, and many others. But what binds us is not our job titles, but the commitment to a common goal, to use the evidence to make the best use of the scarce resources we have, and critically to make a difference. Sometimes it feels like everything has been thrown up in the air, particularly at the moment. We're in the middle of a general election campaign. We've got a third change of administration in just over 2 years, the uncertainty of Brexit, and of course a tough fiscal climate as local councils and other services face choices that they'd rather not have to make. There are also growing social problems, a rise in children and young people's mental health difficulties, increasing child poverty, slowing social mobility, and new risks such as child sexual exploitation or radicalisation. But of course, there are real opportunities alongside this as well. New ways of connecting with communities using technology, new uses of data, as Mark described, and devolution, creating the potential for powerful local leadership on early intervention. So, in the midst of all this flux and uncertainty, today is a chance to regroup, to draw strength from the collective enthusiasm in this room. It's a chance to hear the latest evidence and to discuss its implications together, to go back to the day job tomorrow and to know that we're part of something bigger, a shared endeavour. So, what I'm going to set out today are 3 things. First, why early intervention matters for the challenges we face as a society today. Second, what progress have we made on generating the evidence and turning that into action? And third, what next for early intervention and for EIF? So why does effective early intervention matter for our challenges today? We know that there are economic and human costs of not intervening early. At the end of last year, we updated some work that we did at our first national conference on what we call the cost of late intervention spending. So that's the immediate cost of acute services or benefits for children and young people who face the really significant difficulties in life, many of which could be prevented. And that pie chart shows you where that cost falls. And the overall spending remains high at around 17 billion across England and Wales. It's really important to remember this doesn't capture the wider costs, it doesn't capture the long-term costs. So it's a very conservative estimate. Effective early intervention, and by effective we mean evidence-based, has the potential to make real inroads into some of those big and profound problems that are represented by that 17 billion figure. Whether it's the disparity in attainment at age 16, or gang and youth violence, the distress of serious mental illness in adulthood, many of these problems emerge in childhood. At 3, problem behaviour can be spotted. At age 5, a child's vocabulary is a powerful predictor of their GCSE attainment. At age 7, being involved in youth violence can already be identified, the risk. At age 14, half of all lifetime cases of mental disorders start. So narrowing the gaps early on is critical. If early intervention is effective, it has the potential to unlock the life chances of children. And it should be the cornerstone of the drive to increase social mobility, to tackle vulnerability and improve lives. So what's the progress been on generating evidence and bringing it into greater prominence? EIF is proud to be part of what has become almost a movement, a What Works movement, of What Works centres and similar research bodies. Established organisations like NICE and the Education Endowment Foundation, Kevin Collins is here today, and now, quite rightly, joined by other organisations, including ours, working on new territory such as early intervention. A new What Works Centre for Children's Social Care is planned. Can talk to Steph Brivio and others about it today. She's sitting over there. And a new Centre of Expertise on Child Sexual Exploitation is led by Bernardo's. And there are, of course, also important new insights into the potential for early intervention from developments in neuroscience, genetics, and epigenetics. And these advances are shaping our knowledge and understanding, but we're still some way from how they might inform the specifics of our practice. There's been a big growth in the use of trials to test social policy interventions supported by government, the ESRC and others. And whilst, of course, randomised control trials, and we might talk about that later, are not everything, they are a very effective way of assessing impact. And our director, Tom McBride, who sat next to Claire, will talk about the importance of evidence later on this afternoon in our panel. There's increasing recognition of the need to invest in long-term and also evaluate. And the big lottery fund, I think, has been really bold in this regard. Some of you might be involved in A Better Start, which is a 10-year investment in deprived areas for children from conception to 3. And it's also got really rigorous evaluation built in. So it's an important site of learning. And we found at EIF a real appetite to evaluate the things that people are doing at local level. And that's despite the fact that people have got very limited resources and limited capacity to do it. We've been gathering case studies of evaluated early intervention in local areas to show where results are being delivered so that others can emulate or draw from it. And there's some great examples. Manchester, for instance, has been delivering multi-systemic therapy, showing results for the most vulnerable high-risk young people. And in York, there's a new school wellbeing service created to help meet the growing challenge of mental health difficulties. And these and other examples will go on to a new part of our website called Early Intervention into Action. We have, of course, also undertaken our own What Works reviews, working closely with leading experts from our evidence panel and from wider afield. And I'm just going to mention 3 of them. The first is the work we've done on parental conflict and its impact on children's mental health and other outcomes, and what can be done to address it. We've shown that parents also who are in poverty or facing economic pressure, not surprisingly, are more at risk in terms of experiencing that conflict, but they're also least likely to get the support that they need. We've done a lot of work on the early years, Foundations for Life, focusing on the interaction between a parent and a child from conception to 5. And we found that there is a choice for people who are commissioning these things, 17 evidence-based programs shown to improve attachment or behaviour or cognitive skills. And a third area of work which will be explored particularly in our first breakout session is the work on social and emotional skills, where we looked again at a range of programs which aim to improve children's self-esteem, their self-efficacy, their ability to understand other people's intentions and perspectives. And that helps not only a child manage their anger or aggression, but also, I think, importantly, plants the seeds for greater tolerance. What could be more important in today's more turbulent times? These interventions also help children and young people with strategies for coping with depression and anxiety. Most are delivered in schools and some out of school. And the good news is that there are programs that are effective and also not expensive. We also found in the first part of the work we did in this area that non-cognitive skills have an important independent impact on social mobility over and beyond academic skills. So each of these three, and of course there's lots of other work as well, but each of these key areas of work speaks to 21st century challenges. We want them to inform the future direction on mental health policy. We want them to inform the content of the welcome commitment to make sex and relationship education a statutory part of the curriculum. And we want them to inform how we go forward on social mobility. I'll just very briefly give you a flavour of one programme that I went to visit in Croydon called Empowering Parents, Empowering Communities, which is evidence-based and has a 3 on our scale. It's aimed at disadvantaged families who've got a child with behavioural difficulties. And I went and watched a group of about 10 parents who follow a sort of 8-week course of 2-hour sessions. And they were discussing strategies alternative strategies to avoid and not to smack their child. What I just saw was a conversation that was incredibly skillfully steered by a pair. They have 2 peer facilitators who themselves had been on that same course, but critically, really importantly, have some serious investment in their training and are supervised after each session. That programme demonstrates impact not only on the parents, but also on the children's behaviour. And it is also low cost, so a win on both counts. So what have we been trying to do at EIF to make sure that this evidence is used, is turned into action? So I'll just show you our new guidebook. It's based on the old one, but it's refreshed and updated. It provides information on early intervention programs that have been shown to impact on 7 outcomes, from improving mental health and well-being to preventing child maltreatment and crime. Now, the difference is that it contains only EIF assessments rather than ratings made by other organisations. You can search it by outcome, by the age of the child, by the level of the evidence, its relative cost, and whether it's been implemented in the UK or not. And you'll also find information not only on the evidence, but also on key aspects of how to deliver the programme. So far, the guidebook over its lifespan has been accessed by over 85% of local authorities. We hope that many more people will access it, and we'll be adding new programmes as we do new research. But we really want feedback from you. Is it useful? How could we improve it? And where do we take it to? We've also been taking the work that we've done on the early years, Foundations for Life, out across the country, led by Ben Lewing, and we've had evidence seminars. We've reached 2 out of 3 local authorities. And we wanted to know, while people were sitting at our evidence seminars, whether they were listening, although they seemed to be listening. So we commissioned some independent evaluation to test. Ultimately, we want to know whether it tests whether people change their behaviour. We're only at the first stage at the moment, but interestingly, people did say, 80% said, that attending an evidence seminar had changed their understanding of the evidence for parent-child interaction, and 70% felt more confident about using that evidence in their decision-making at work. And there was an eagerness to seek out further evidence. Now, in the next few months, we will know the answer to the rather more important question of whether this greater confidence turns into tangible actions. So, what next for the work of early intervention and EIF? And obviously we'll be talking about that for the whole of today. Jo, and I'm really delighted that you've taken the job and that you'll be starting, our new chief exec, but you will obviously want to imprint your own stamp. But we've been doing some reflecting on where we think the work could go to next, and we wanted to share 3 priorities with you. The first is we need to get more of this evidence used. there's some really significant gaps between what the evidence tells us and what people actually believe and do. There's some areas where the evidence is quite clear. So, for example, in the first year of a child's life, supporting parents to manage their child's behaviour or handing out books has no impact. We shouldn't be commissioning it. But despite these clear messages, this isn't actually what we deliver. Another example is a forthcoming report that Donna and others have been working on child protection, which also shows this gap, and she'll be talking about it later in Breakout 2. And of course, applying the evidence requires us to support implementation and recognise that implementing evidence-based programmes, generally implementation, is very challenging. So I really like this analogy of used by an American colleague, David Osher, of a chef in a busy kitchen, trying to get the meals out, and then on top of that is given a new recipe at the last minute and has to deliver that as well. And it can feel like that if you're trying to deliver the service as usual, and then you're trying to do a new programme. Better Start Areas are trying to do this right at the moment. How do you do it on top of the day job? In Wales, Incredible Years, which is an evidence-based programme, has been replicated at scale, but a number of factors are needed to be in place to make that work. So local champions, you have to pilot it, you need a supportive public policy context, you need to do ongoing evaluation, fidelity, and also have political support. That's not impossible, but it is a substantial investment and a long-term task. So we also need to be smarter about how we use digital technology to put the evidence and the messages in the hands not only of practitioners who are working at the front line, but also children and young people themselves. That direct access, it feels to me, really has the potential to empower people themselves, children and young people themselves, to understand their own needs, their risks, and then to seek support. So evidence requires, if we want to get this evidence used, creating a demand for it, supporting people to see its value, ensuring that messages from evidence are clear and easy to access, and that there's the capacity and resources to implement it. So secondly, we need to grow the UK evidence base. Our work on the early years and interparental relationships shows that there are programmes which have a good track record in other countries, often in the USA, but not solely, but have not been evaluated in the UK. When it comes to parental conflict and tracking impacts on child outcomes, our evidence is still at a relatively early stage. We need to build it. And we know, as you know, that context and who it is that you target at what level of need is absolutely critical. Interventions that work in some circumstances, for instance, to support parenting, won't work in situations where domestic violence or abuse is present. I heard from an area the other day about parents who'd been sent on the same parenting course multiple times because it was the only service that was available. It didn't work the first time, and it didn't work the third time because it wasn't actually the right service for that family. So we need to develop our understanding of what works for whom and communicate that really clearly. Of course, what works evidence isn't binary, and I know we've said that before. Many of the programs that either you might use or that are being developed don't reach our evidence standard of level 2, but they are on a journey of improvement. And the people who are doing that work, developers or deliverers, need assistance and help to build that evidence in a way that's proportionate to the amount of money that's invested in that program. So, the third area that we're going to talk about is developing the evidence into the wider territory, such as workforce, practice and systems. And I'm going to ask Donna Molloy, who's our Director of Dissemination, to talk some more about that. So, over to you, Donna.
Thank you, Carey. Of course, part of the task in getting evidence used is making sure that evidence is available on the things that people need help with in the first place. And this sounds blindingly obvious, but doesn't always happen. And I hope that academics and evidence colleagues in the room won't mind me saying that occasionally, just occasionally, evidence is produced which is not that useful, because it doesn't speak to the most important challenges that policymakers and commissioners face. So I just want to offer a few thoughts on how we make sure our evidence is relevant at EIF. Because for evidence to take its place centre stage in how we develop early intervention in the UK, it has to answer the questions that those on the ground are asking. And we want to play a role at EIF in helping the evidence keep pace with innovation, in understanding the key questions of the day, in getting evidence work underway so that we have something to offer to guide activity on the ground, which requires us to diversify our evidence work, just tentatively, not entirely, beyond just looking at the evidence for early intervention programmes, which many of you have emphasised to us for some time now, is only part of what you need to know in trying to deliver an effective early intervention system locally. But here, we know much less about effectiveness in relation to early intervention systems and practice. The evidence is much less developed on questions such as how you ensure those who need help are spotted as early as possible, and how to equip different groups of practitioners to develop the sorts of relationships that can support real change, and so on. So these two areas of early intervention practice and systems are areas that we want to explore in the forward work on evidence in the Foundation. Firstly, children's services departments everywhere are asking, how do you build capacity in the wider system to spot and respond to problems early on so that everything isn't continually pushed up to children's social care? As you will all know, a significant proportion of referrals to children's social care currently result in no further action or things being passed on to another agency. And so everywhere, people are innovating in this space, trying to embed capacity for early intervention across public services, going beyond traditional workforces. And this involves working out how to equip frontline practitioners in the wider system with the skills to spot risk and respond. And we need to develop the evidence to support this, to support practice, to help practitioners feel able to ask the right questions. And the result here won't always be about uncovering the need for an expensive specialist intervention. Sometimes the solution will lie in the existing relationship between the practitioner and the child, the young person, or the parent. So how can we equip practitioners across the system to develop the sorts of relationships that can change lives? To give an example, which is not the most obvious one, the police are a good example of a part of the system where there is huge capacity for early intervention. There have been significant changes in recent years in the nature of policing, as many of you will know. The College of Policing now estimate that 84% of contacts with the police are non-crime incidents. Operationally, the traditional focus and emphasis on law enforcement doesn't have much to offer here. In West Yorkshire, an area we're partnering with at the moment, a senior officer lamented to us recently that the majority of what frontline officers deal with now is mental health, vulnerability, domestic abuse, children going missing, concerns for welfare. But we train people to patrol crime hotspots, interview suspects, and arrest people. Police forces are putting resource into early intervention, creating new dedicated roles. Lancashire are developing new early action police officers. West Yorkshire working on a strategy to develop a workforce equipped for early intervention. Officers who are able to prevent problems rather than just react to them. And this is an area where the evidence needs to develop to support early intervention innovation on the ground. What would evidence-based early intervention practice look like in frontline policing? There's not a readily available manual on this, or if there is, we haven't come across it. And how can we support not just operational police, but other frontline workforces who are not the usual suspects in relation to early intervention, to build relationships, to see the vulnerability that lies behind antisocial aggressive or risk-taking behaviour, and to be trauma-informed and work in a multidisciplinary environment. And of course, this isn't just about public services, and increasingly much of the innovation in this space are happening outside public services, as models of volunteers, mentors, community champions and so on are developed to support others in their local community. And how can we ensure that all of this activity is informed by evidence so that motivation to help is channeled to best effect? There are real opportunities, we think, to affect change here if we can develop the evidence to support this activity. The second pressing area where we think the evidence needs to be developed, which I'll just mention before handing back to Carey, is to test effectiveness in relation to some of the integrated models of early intervention and early help. Pressures of rising demand and reducing budgets are being felt everywhere across the system, and everywhere people are trying to bring together the work of different agencies. Whilst of course integration and multidisciplinary working are not new, this does now feel in some conversations more clearly on the table than ever before. The old agency silos are just not sustainable, and it feels like everywhere we go, people are innovating with new structures, integrated early intervention hubs, locality teams and so on, shared referral and assessment functions. Yet there's a striking lack of evidence to guide all of this innovation activity. I think one of the most recurrent questions we've been asked by local places since we started back in 2013 is which types of integrated models are showing most promise, are starting to deliver results. But as you'll hear from Ben Lewing in Breakout 3, this is a question we can't answer at the moment from available evidence. And we've tried to make some progress on this, looking at how to develop consistent ways of describing these systems in order to start to develop evidence which is about impact, not just process. And so we hope to start to make progress on some of these areas of practice and systems over the next phase, EIF, to start to illuminate a direction of travel, and in so doing, evolve the evidence base on early intervention to meet the needs of the future.
Thank you, Donna. There's been real progress, much done, but much still to do on putting evidence into action. But if early intervention is going to respond to many of the new challenges we face, it requires not only the intelligent use of evidence and a smarter state, as described by Donna, but also investment and commitment. Many of you are grappling with unprecedented pressure on statutory services at local level. In this context, it requires commitment, creativity, collaboration, and sheer determination to put early intervention at the top of your agenda. And I know that you'll see quite a lot of those examples of that today. This challenge is more significant than ever, but using the evidence to commission more smartly is part of the solution here. For example, the most vulnerable children on the edge of care is where a lot of the cost is. And if we could get this bit of the system right and deliver the things that have impact, it could free up resource that could be used upstream. But we don't always get this bit of the system right, as you'll hear right at the end of the day, and I really hope that you stay to the end of the day to hear Kerry Littleford talk about her experiences. So alongside smart commissioning, early intervention requires also bold, smart and long-term investment from across the public, private and philanthropic sectors, and built into that investment, the capacity to test, to learn and to adapt. It also requires commitment from politicians across the political spectrum, from practitioners, from communities themselves, and there's also plenty of commitment in this hall today. Finally, just some very quick personal reflections. You of course have heard that I'll be leaving EIF this summer. It's been a tremendous experience. I'm really so lucky to have worked with such talented and committed people in the team, on the team that we began with and the team that we have today, on our board, our evidence panel, our places, the many civil servants that we've worked closely with, and many other partners. I'm really proud of how together we've built an organisation. EIF is not an a 2-minute wonder. We're here to stay. We have new premises. We have future funding from government departments as well as from other funders. We've brought really important evidence to light that goes to the heart of what enables a child to flourish, whether that's attachment, early language, self-regulation, mental health, the ability to spot vulnerability and risk. And we're playing an influential role both with government and on the key issues of the day. And I think because we're rooted in local areas, the work that we've done on the evidence side has been cutting edge, close to some of those innovations on the ground, able to anticipate change. So I feel that I'm leaving EIF well placed to take early intervention to the next stage. I'm really looking forward to today, to be able to talk, exchange ideas, develop new insights, recharge our batteries, and plan the next steps. I really hope you enjoy today as well, and that you go back with new insights and renewed vigour. Thank you.